Hi guys, George Dudziak, Doctor of Physical Therapy here, owner of Verbal Rehab, here to talk about lower back pain and 4 questions you want to ask yourself to save yourself time, money, and frustration. Question number 1. When do I get it the most? Time of day, and more specifically, what positions? So sitting, does it increase or decrease my pain? No difference. Standing, same thing. Exercise, lifting, running, think of the positions there too. Is it upright with high impact activities, upright with low impact activities, say elliptical, or is it sitting on the assault bike with a little hunch, or even upright? Sometimes that can bring on more or less symptoms, so see what changes there. Second question, what areas are associated with that pain? New symptoms of pain in the groin itself. Sometimes those go hand in hand. Pain on the side of the hip, pain on the buttock area. Back pain can sometimes affect both of those areas. Sometimes you could have irritation or structural deficits at both areas. So you want to make sure you address both of those areas in the long run. Third question, which direction do I have a loss of range of motion? In many cases, especially after several weeks of recovery, muscles should get better, should pretty much fully recover. And then you bend forward, you shouldn't have a loss of range of motion. In many cases, back pain, after those several weeks, it should fully recover. Question, if you have a loss of range of motion, can you touch your toes again? Same with the side bending. Do you have a loss of range of motion? Can you reach to touch the knee on both sides equally? Is there any associated pain with one versus the other? And make sure you're not compensating by twisting or bending forward. Most telling range of motion test is the extension. When we back bend, those muscles in the lower back don't help much. They turn off. There's minimal activity. So if I'm back bending and there's still a loss of range of motion or increased pain, then we can say that it's not the lower back muscles. You can massage it out, you can foam roll it till you're blue in the face, but if you don't address the deeper structures, then you're going to keep struggling with this back pain. Fourth question, last question. What changes with the back bending? So test it in standing first. See what difference there is on one side versus the other. Sometimes it could be both. Sometimes it could be dead center on the spine. And then go to laying down. So when you're laying on your stomach, or in any position really, most back pain is going to feel relief. You're decompressing multiple structures. Muscles turn off. You're not loading the spine as much with gravity because you're laying down. So go to that laying on your stomach. After several minutes, get a baseline of your pain. See what will change once you press up into that fully extended position. Arms locked out, hips stay on the table or the ground. See what changes in your pain level. Does it get worse when I do it? Is there any pinching up or down? Is it shooting down the leg? Do it for 10 or 20 repetitions. Extend the elbows, keep the hips down, release. Extend the elbows, keep the hips down, release. After 10 or 20 of those, if you're getting farther or the symptoms are decreasing at the lower back, or symptoms are changing for the better in the leg, you have no symptoms there, it's not as far down the leg, then something's changed in a good way. So those are the questions you can ask yourself to say, what are the possible structures and how can I address it? These are the things I take most of my patients through, along with special tests. A lot of the special tests I can't show you here because it's very difficult to explain. It'd be very, very long of a video, but feel free to shoot me an email, message, Facebook message. You can check out my website for a couple articles that I've written up about spinal pain. Reach out to me with questions you have, specifically about lower back pain or other areas. Thanks.